Thank you so much for joining us today, Dr. Gayatri Priyadarshini, who's not just MBBS, DNB, and a fellow of the Royal Society of Radiologists in London. And she is somebody at her care with so much experience, nearly 10,000 ultrasounds till date, and we've got close to over 1,300 HSGs, which is today's topic. So, Doctor, can you begin by telling us what is an HSG test? And do all women who are trying to conceive need it?
So, a HSG is a very specialized form of X ray. It's a procedure where we inject a contrast that's known as a dye inside the uterus, and we'll be taking the images to look at the fallopian tubes. The primary importance of the HSG is to look at the fallopian tubes. So, as most of the viewers would be aware, the fallopian tube is something that connects the ovary to the uterus, and the egg gets released from the ovary, travels through the fallopian tube, and that's where it meets the sperm. So, if there is any issue going on with the tubes, say a damage or blockage, then the egg is not going to be able to meet the sperm. And through this test, we are going to test the fallopian tubes, whether they are open and are they going to support the pregnancy or not. And coming to the topic whether all women need HSG, the answer is not everybody needs it. So when you look at who needs HSG, we are going to primarily focus on females couples who have been trying to get pregnant, say at least for the last 6 to 12 months, and they have been unsuccessful. And also we will be looking at other history, say if they have had previous history of, say, pelvic tuberculosis, infections, major surgeries in the abdomen, which can lead to blockages. So it's not like a one size fits all. And when it comes to the factors affecting who needs a HSG, there's always the duration for which they have been trying to conceive, the age of the female, and the ovarian reserve as reflected by the AMH values, their personal history of surgeries and medical situations like tuberculosis. So these are the things that we take into consideration before we recommend a HSG for someone.
Fantastic. Thank you, doctor. That is so clear. Can you, for example, describe a typical patient who might need an HSG? We often find that people keep trying naturally without, wondering whether the tubes are open or not. What would be a typical person who needs an HSG but doesn't know it?
So there are two category of patients. One will be somebody who has other factors which influence pregnancy. Say they have PCOD, they have a male factor deficiency, and then there's the other category where every test is normal. So first, let's deal with somebody who already has issues. Say somebody has been trying for pregnancy, they have been doing their ultrasounds, checking whether the ovulation keeps happening, and some need support in the form of ovulation induction drugs as well. And we see ovulation is happening normally for them with some external support, even injections like beta HCG to trigger the ovulation. And in some cases, they go ahead and go for IUIs as well. And for IUI, patent tubes are a definite must. And when they keep trying for multiple cycles, say even more than 2 or 3 cycles, and yet do not end up with a positive pregnancy result, at that point it's mandatory that they check their tubes, because when they keep trying for pregnancy and they ignore the factor of the tubes being open or not, repeated tries are not going to yield a positive result end of the day. So it's always recommended that the tubes get checked. And coming to the other category where every test has been normal and there's nothing abnormal, so these fall under the category of like there's no proper cause for the pregnancy to not happen. In those patients as well, we do the HSG. One majority is to check the patency of the tubes again, and the next one is to flush the tube so that it can enhance the chances of pregnancy.
So, doctor, with unexplained infertility cases, what you are saying seems to suggest that the HSG test itself can remove some mild blockages if there are blockages in the tubes.
Yes, that's correct. Yes. So, due to the flushing nature of the dye over the tubes, that can remove small blockages and opens up the tubes in a way that majority of the patients, they get a positive results, fortunately, within the next few months after HSG.
Then why are so many people afraid of this test, doctor?
I would say that it's mostly because of the stigma associated with the HSG. Those who are aware and those who are not aware about the HSG. Those who are aware about the HSG, including the gynecologists themselves and the patients, they Google about it, they read that it's going to be so painful. But if it's done with the right technique and the right pre-medications, it's going to feel more or less similar to one of their ultrasound scans, I would say. That's what most of our patients say, that it didn't create like a lot of issues, and why did they end up getting scared for nothing is what they say. And then there's the other subset who are not aware that HSG is a minimally invasive procedure which can test the tubes. According to majority of the patients, when we ask them what is your opinion on how would you get your tubes tested, they just blindly tell they will go for a laparoscopy where they test the tubes. So that's a major surgery end of the day, and involves anesthesia and stitches, and that's more invasive. So the awareness about HSG being a very easier way to test the tubes compared to a proper surgical option is something that is lacking among the population, I would say.
How long does a test take, doctor, typically? Should a person have to take half day off? Is there hospital admission involved?
So it's a daycare procedure. The entire procedure itself would barely take around 5 to 10 minutes. If we find a block, it might extend for another 5 minutes, but nothing goes beyond 15 minutes, 10-15 minutes tops. And regarding the procedure, it's daycare, meaning they come in for the appointment, we give the medications, the test gets done, they get their result in a short while, they go back to their routine activities. They have to follow some very small precautions, like not driving for the next couple of hours, because we would have given them some medicines which can cause drowsiness. Same like cough medications, you are not advised to drive when you take them. And they can go back to their routine activity in an hour or so, and they need not take even a half a day off. So if they can finish their office, come in even in the evening, we'll finish and send them off. It's has its own advantages, that there's not a lot of downtime or anything to be concerned about.
Fantastic. Doctor, just like to make it clear to the audience that we don't have any financial arrangements or, any kind of commissions or anything. And I must say that every patient we've referred to you till now, they've had such a smooth experience that, it certainly busts the myth of an HSG being a painful technique. Is this something that you would say can help some people avoid unnecessary IVF?
Yes, it definitely can, because when they try IUI, say for 2, 3, even 5 cycles, and it keeps failing, and they don't even discuss the option of checking the tubes. Sometimes they directly go for an IVF. Again, the patient's situation is one factor that influences it, but when people go through IUIs and do not get a positive result, it's always better to check the tubes, wait for a couple of months at least, because we have seen quite a bit of patients who have conceived after a lot of failed IUIs and then flushing their tubes, and even the same cycle they do get pregnant naturally as well. And so IVF is still an option, but again, they can give HSG a try before directly going for IVF again.
Fantastic. Thank you so much for your time and this very valuable information, Dr. Gayatri. Wish you all the very best.